Saskatchewan medical students are calling on the government to cover the cost of birth control.
To implement prescription coverage of contraception in order to reduce barriers of access to a majority of our population and therefore better the lives of each individual patient, but also the state of our province.
BC began providing universal coverage on April 1st. In other provinces, some politicians say they'll do the same if elected. In Saskatchewan, advocates say it's a big problem that people can't afford birth control.
IUDs can cost $400 up front, whereas the contraceptive pill can be $20 to $30 per month, which is $240 per year.
They also say coverage for birth control would be cheaper than covering the cost of an unplanned pregnancy.
In Regina right now, a termination of pregnancy costs $2,200 for the healthcare system, which is rightfully covered by our government, but it is quite a stark difference, whereas a live birth without any complications costs our healthcare system around $8,000.
The Saskatchewan NDP has also been calling for change. The politicians started a petition for universal coverage more than a year ago.
So far, we've heard nothing but crickets from the government around this call to action. Not only is this something that is very much needed for promoting and advancing reproductive rights, which are human rights, but it's also a wise economic measure for the government to be taking.
But the Sask party government has no plans for change. The health minister says the existing model is good enough.
We do support a lot of contraceptions through either distribution of condoms through community-based organizations, or if there is people that are on supplementary health benefits, that's another option for them, for people that are having some financial challenges.
The medical students say the current model does not go far enough.
And having condoms rather than the IUD or the pill, it doesn't place the autonomy and control of reproductive health in the hands of the person that has the uterus.
The students say they won't stop pushing for change, hoping to improve access to healthcare and make a difference in the community. Kendall Latimer, CBC News, Saskatoon.
There's already paid more than $1 billion.